So let's move on now to the Keynote 55 data. What was this study and what did it teach us?
So as we were saying before, for patients who fail both platinum and cetuximab, one of the only available agents there is methotrexate. And as I was saying before, the response rate to that drug is very, very poor. And the outcomes are not good. So the overall survival for this patient population is only about 6 months. So patients who fail these things that live for 6 months, and then unfortunately they will die. So what Keynote 55 sought to do was to take these patients who are often quite ill and are heavily pre-treated, meaning they've been through a lot of other treatments, and we say, okay, well, let's see if pembrolizumab can work in this sickest of the sick population for head and neck cancer. And so patients were enrolled in the study. We have 171 patients that we treated on the study. At ASCO this year, we presented data on 92 of them because the study only finished relatively recently. And what we found was, first of all, it was really well tolerated, consistent with what we've said here. Only 12% of people had any serious side effect.
Wow. In the cancer world, that's a really impressive number, especially in head and neck cancer.
Yeah, and there was one case of pneumonitis, which is the inflammation in the lung that Tanguy was mentioning before. Unfortunately, the patient did die in that situation. So these are real problems. But overall, a very well-tolerated drug. And then the response rate in this population was about 17 to 18%, depending upon how we measured it. And beyond that, an additional 18% of patients had stable disease. So a definition of a response in cancer means that you measure all of the tumors and the amount of tumor goes down by 30%, or at least. We call that a response. But for patients, there were 18 patients who still were getting the drug and their disease was stable, which in the metastatic cancer world is still a win.
Which could mean as much as 29% shrinkage.
Exactly.
Stable.
And in fact, the patients who were on the drug for multiple scans, and if we look at just the amount of people who had their tumors get smaller, 54% of patients had their tumors get somewhat smaller. So that's really, really exciting for a group that previously we were just saying have very limited options. We saw that there was a marked improvement in what we would expect for both progression-free survival, meaning the combination of people not progressing on their cancer and not dying, as well as in overall survival, which was just measuring of how long people live. So on average, patients were living about 8 months, which is much better than 6 months we were seeing before. And in terms of progression-free survival, at 6 months, 24% of patients still hadn't progressed. So that's related to that tail of the curve you were talking about before. So this was particularly exciting because we have here the sickest of the sick who have limited options, and we were still able to move the needle and advance the care for these patients.
So,
yeah, and I think just to add to that, those patients that do have benefit, it's oftentimes durable.
Mm-hmm.
And I think that goes exactly along with what you're saying. And I just wanted to emphasize that these treatments have the potential to provide durable benefit. And that's different from all the other treatments. They're well tolerated, so you can keep going. And some patients have durable benefit. Not everybody has durable benefit. On average, we move the needle, but for some patients, we move the needle by a lot. And that's really the remarkable part, in addition to what Joshua already pointed out.
At this time, 75% of the patients who responded to the drug are still responding.
Yeah, this is inspirational, especially in the context of the history of these agents.